Vaccine-preventable diseases are making a comeback. Rodney Throgmorton never thought one of the most dangerous and contagious of those diseases would break his family's heart.
I'd always felt like I'd led a charmed life, and I had delivered a baby. I had played in the state championship game. And I always thought that bad things happened to other people. But when I was faced with the death of my daughter, I realized that bad things happen to everybody.
In 2003, Rodney and his wife, Jerry Lynn, celebrated the birth of their daughter, Haley.
She decided to come into the world 12 days early, and we didn't even make it out of the house. I got to deliver her, and that was the greatest thing I'll ever accomplish.
But that joy was short-lived. When Rodney came down with a cough he caught from his mother, he had no way of knowing it would result in Haley's death.
When Haley first started coughing, I knew that it wasn't just a normal cough.
After extensive testing, Haley was diagnosed with pertussis, or whooping cough, a disease that largely disappeared after a childhood vaccine was introduced in the 1950s.
When she was first confirmed to have pertussis, we were kind of in disbelief. I know that I passed pertussis on to my daughter, and I know I got it from my mom. We have no idea where my mom might have got the disease, but it had to have been from someone who wasn't vaccinated and someone who had the disease.
When she was just 6 weeks old, Haley lost her brief battle with whooping cough. Haley never had a chance to receive a dose of DTaP, the diphtheria, tetanus, and pertussis combination vaccine that could have saved her life.
Haley passed away when she was right at a month and a half old, and she wouldn't have received her first round of DTaP until she was 2 months old.
There are children that may be too young to receive a dose of vaccine. When vaccines are licensed, they do have a lower age cutoff, and they may still be vulnerable to that disease. Transmission of pertussis from parent to child is a big issue.
If you immunize the adults and the caretakers and make sure the children in the household are all adequately immunized against pertussis, it's much less likely the child will get pertussis.
The Centers for Disease Control recommended in 2006 that all adults receive a Tdap shot, a whooping cough booster shot for adolescents and adults that can provide a shield of immunity for infants too young to receive their first DTaP shot. Unfortunately, the Tdap vaccine came too late to protect Haley.
Less than a year after my daughter contracts pertussis from me, it was a little frustrating when I found out that there was now a vaccine about to be available that would have protected me, and subsequently I would have protected her. If my parents and I had all been vaccinated, then she wouldn't have got that from us. The worst possible scenario would be your child getting a vaccine-preventable disease from you, or your grandchild getting a vaccine-preventable disease from you.
Adults and adolescents who are immunized provide newborns with a cocoon of safety against disease. It's a type of immunity protection known as herd immunity.
Herd immunity, community immunity, is the concept that you don't have to vaccinate 100% of the population to prevent the spread of disease.
So that if you have a herd that's well immunized, even if you bring in someone who is not immunized or who has the disease, the herd is by far more protected. And that includes not just your child, but it includes perhaps your aunt who's on chemotherapy, other people in the community, not just children who haven't been vaccinated, are at risk. And so herd immunity is a very important concept.
There are hundreds of thousands of people in the United States who cannot be vaccinated. They can't be vaccinated because they're getting chemotherapy for their cancer. They cannot be vaccinated because they're getting immune suppressive therapy for their transplants or their rheumatologic diseases. They depend on those around them to be vaccinated, because otherwise they're the ones who are most likely to suffer or be hospitalized and die. They depend on us to protect them. And I think it's our duty to protect them. And what's happened to herd immunity is it's breaking down.
And that breakdown in herd immunity is evidenced by the resurgence of whooping cough cases in the United States. In the 1940s, at the height of pertussis infections, there were 250,000 cases annually. When the first whooping cough vaccine was introduced, the number of cases plunged to just over 1,000 3 decades later. But in 2010, more than 21,000 people got whooping cough.
You can say comfortably that herd immunity is broken down, and now we're all at risk, at greater risk. And so a choice not to get a vaccine now is a more risky choice than it was arguably 10 years ago.
And pertussis cases have multiplied in Florida from the year 2000 to 2010. In 2000, there were 48 reported cases of whooping cough in Florida. In 2009, there were nearly 500 cases reported in Florida.
Pertussis is still a disease that's uncontrolled in the United States. It can be with vaccination, but we're not there yet.
Some diseases are so highly contagious, measles, mumps, whooping cough, chickenpox, that you need a very high percentage of the population to be vaccinated in order to prevent spread.
In Florida, our rate is in the low 90s in terms of overall vaccination. And that's really good under one lens. On another, we don't have to be perfectionists to realize that we want that higher.
We need to achieve those higher than 90-95% levels of coverage in order to prevent transmission.
Even when we look at overall vaccination rates, which may be quite good, we have to realize that that's an average across a state or across a country. And so there's still going to be pockets where it's much lower. And we've seen this with outbreaks of measles and pertussis and other diseases, Haemophilus influenza.
An outbreak in measles in several northeast Florida counties in the early 90s illustrates the danger. Close to 200 cases of measles were reported in 1991 and early 1992. 82% of the cases involved people who were unvaccinated. Of all the reported cases, 47% occurred among children younger than the routine age of vaccination, a dramatic breakdown in herd immunity.
What you're seeing then is an erosion in vaccine rates in certain communities in this country that has caused an outbreak in vaccine-preventable diseases, that has caused children to suffer and be hospitalized and die. It's unconscionable. It's not okay. And yet we let it happen. How many more children have to die before we say this is enough? Is that the only thing that's going to turn us around? That we just haven't had enough children die from these diseases?
While disease can spread within tight-knit communities or families, it can also come from across the state, sometimes from across the world. It is all part of the risk of living in a mobile society, a risk that has existed for hundreds of years.
The mobile society started, from our point of view, right, in the United States, when Columbus discovered America. And a whole series of infectious diseases that were in the old world, in Europe, were introduced to the new world, among them smallpox, with devastating effects on native populations. Interestingly, many infections in the New World also were introduced into the Old World. And so this idea of mobility, of connecting populations that were previously separated, has been around for hundreds of years. Almost all the epidemics, the small ones we've seen in the United States in the last couple of decades, have come because of returning visitors, returning tourists, people on a mission trip somewhere else, who come back to the U.S. And because there's an incubation period, meaning there's a time when you're infected before you show any symptoms, it's very easy to go back home, be infectious, contaminate other folks, and not know you're sick at all. Then you show the first signs of disease, and it's in some sense too late. You've already spread the condition to everyone else in your community.
In 2009 in South Florida, there was a deadly outbreak of the W135 form of meningitis, a strain covered by the meningitis vaccine. The outbreak left CDC officials baffled. While they had studied outbreaks of the disease in Africa and the Mideast, they had never seen a case like the one in Florida. 4 people dead and 8 others ill in one area with no obvious connection between the patients.
Visitors to South Florida and Central Florida can bring with them diseases even when they don't know it. So they might get on a plane feeling perfectly fine, because we know when you get infected with something, there are several days, sometimes several weeks before you feel sick. And so they can come into our state and pass an infection along to the rest of us.
Measles is an example of a vaccine-preventable disease that continues to spread in our mobile society. The spread of measles was declared eliminated in the U.S. in 2000. But in 2008, there were more than 130 measles cases reported in 15 states. The CDC says close to 90% of those cases were either acquired abroad or linked to imported cases. More than 90% of those infected had not been vaccinated. In February of 2011, the CDC warned that tens of thousands of airline passengers may have been put at risk by a 27-year-old woman who tested positive for measles and traveled through airports in Washington, D.C., Denver, Colorado, and Albuquerque, New Mexico.
These viruses and bacteria do not need passports. They don't need green cards or visas or anything else. They can travel anywhere they can. And we live in a global society where people are constantly moving back and forth.
Janice Flood Nichols is a polio survivor who lost her twin brother to the disease. She says even though wild polio has been eradicated in the U.S., it remains a global threat.
In 2010, we had just under 1,000 new cases of polio. But public health officials now know that just the way that we move in society from area to area, country to country, continent to continent, if we don't eradicate polio soon, within the next few years, we'll lose our last best chance, and that by mid-century, more than 10 million children will be paralyzed by a disease that no child or young adult has to get.
I think we need to be mindful that these diseases are not all eradicated, that the childhood immunizations are very important for our children here, particularly in a place like Florida where we get new immigrants all the time, as well as families who travel elsewhere.
It looks like she had 2 measles shots already, so we don't have to deal with that today.
4-year-old Kennedy may be a little girl, but she's about to take a big step. Kennedy is receiving the vaccinations that will enable her to begin pre-kindergarten.
Her shot record expires on the 8th.
I'll get you another one.
Making sure shot records remain accurate and updated is not always easy.
Frankly, the current immunization schedule is complicated. I mean, we now are up to giving vaccines to prevent 14 different diseases in the first few years of life. There's another couple vaccines that we give in adolescence. There are also different vaccines that we give to adults, including elderly adults. So it's confusing.
Confusion that increases when records get lost and when families move and children change schools.
They change schools and the school needs a new vaccine record. Well, where is it? And who has it? And maybe my pediatrician retired and I can't get those records anymore. This happens to us quite frequently.
According to the Centers for Disease Control and Prevention, by 2 years of age, over 20% of the children in the U.S. typically have seen more than one healthcare provider. This can lead to a paper chase for parents and schools.
Parents don't always present with the document that we need, meaning the immunization document.
Computerized databases called vaccine registries help parents, providers, and schools deal with what used to be a daunting task by consolidating immunization information into one reliable source.
And what a vaccine registry allows families to do and pediatric practitioners to do is to know which children have had their vaccines when.
Florida's online immunization registry is called Florida Shots. Florida Shots is secure, confidential, and free.
I found that My Florida Shots has been a wonderful tool.
Florida Shots has improved my life in terms of work a lot.
They aren't the only fans of Florida Shots. The Florida Pediatric Society and the Florida Medical Association, among other organizations, have endorsed it. Florida Shots has also been honored with several national awards. Another measure of Florida Shots' success: more than 110 million shot records have now been uploaded and processed through the Florida Shots Registry. Those who have seen the benefits of Florida Shots have a message for healthcare providers and parents.
As a school nurse, I would strongly recommend, or maybe even plead with physician offices, healthcare providers, if you currently do not use My Florida Shots, please seriously think about doing so.
Florida Shots is a program of the Florida Department of Health, Bureau of Immunization, and is supported by the Centers for Disease Control and Prevention. One of the ways Florida Shots works to maintain high immunization levels is by providing reliable record keeping that's often hard for parents to keep up with.
Parents of children who are 2, maybe 3 years old, in the time when the children are still young and you're carrying around a diaper bag and you have everything with you, it's hard for parents to imagine that they will ever forget their vaccine card. So they may not realize how useful something like a vaccine registry can be to them.
Dr. Judy Schechter with the University of Miami's Miller School of Medicine says Florida Shots eases the record-keeping burden on parents and schools.
The schools, the parents, the camps where kids go have a computer printout where the dates are all nice and clear. They don't have to rely on our bad doctor handwriting, and so things are right there and ready for them.
We often receive handwritten documents from a physician's office or another health care provider type clinic situation. They're not always clear, they're not always concise, you're doing a lot of hunting.
Paula Alford with the Florida Association of School Nurses says she has seen her share of sloppy immunization records, but she says Florida Shots earns an A+ for reliability.
To have that clear and concise document from My Florida Shots, there's no guesswork involved. Ideally, we have quite a few students that we are servicing, and time is of the essence.
Time is of the essence, not just for schools and daycares, but also parents and healthcare providers, which is why Florida Shots' ability to determine correct dosing schedules is critical. It helps ensure that children get the right vaccines at the right time.
It also has certain alerts that tell you when a vaccine is overdue. Now, we as physicians know what that is, and we can look at those dates. But if other people are looking at it who might work with us, if a school wants to look at it, there's an alert to say that something's overdue.
And as children grow, Florida Shots keeps them on track.
It's also a record for the entire lifespan. But probably the biggest reason that vaccine rates are not complete in teenagers is that parents don't know that they need vaccines. So many of them were carrying around their little yellow card, and thank goodness we now have Florida Shots to help augment that.
We don't want anyone getting a dose of a vaccine if they don't need it.
Dr. Andrew Kroger with the CDC says while vaccine registries like Florida Shots help identify immunizations that may be due or overdue, they also prevent unnecessary shots.
It can avoid duplicate administration of doses, which saves a lot in terms of time for patients and parents.
It makes it a lot easier with it already being the information already being in the system.
Barbara Ocasio is an office manager who uses Florida Shots to help patients follow the correct shot schedule. It also helps parents in a pinch.
Especially kindergartners, they call in the day that school starts or the day after school starts. I'm getting ready to kick my child out because I don't have my immunization form. We can get it to them in no time. Now if they call and need a form, we can have it for them in a few hours, if that long. It used to take us at least 24 hours or longer before we can get the form to them because we had to fill them out by hand and then give them to the doctor to sign them.
Florida Shots also makes life easier for families on the move. Change doctors, change addresses, Florida Shots keeps up. When shot records are entered in the Florida Shots database, they become available to any medical provider in the state, allowing your healthcare providers to exchange important immunization information.
Children move from school to school and from school district to school district, and having a universally available, if you will, within the state database is just wonderful.
But vaccine registries like Florida Shots go far beyond the personal. They also help improve public health planning.
It basically allows public health to track vaccine doses, measure coverage, measure the efficacy of vaccination programs, and allow efficient ordering.
And that efficient ordering can be key to helping keep provider costs, and by extension, patient costs, down.
It can save a lot in terms of money, in terms of paying for vaccine doses.
While Florida Shots works to ensure that providers can access immunization information, it also safeguards that information. The Florida Shots Registry is located on a secure server with password-restricted access and the latest encryption and firewall safeguards. All authorized accounts are given access to the system only after the Bureau of Immunization has verified that they have appropriate licensing in the state of Florida and they have completed training.
It's also incredibly private. Like any health information that we have, it is protected by both state and federal law so that your child's information is not getting out to whoever wants to look at it.
Florida Shots is also there in the event of an emergency. Because records can be accessed online around the clock, they're available anytime or anywhere they're needed. In a medical emergency, hospital emergency rooms can access Florida Shots for your child's up-to-the-minute immunization status.
But let's say you had to go to the emergency room because you had your foot got cut when you're outside playing. You don't know when your last tetanus shot was. Well, by having a vaccine registry, the doctors in the emergency room are able to find out, well, what vaccines have you had and what are you missing?
While Florida Shots can provide help during medical emergencies, it can also be a crucial link to health records during natural disasters like Hurricane Andrew, which devastated South Florida in 1992 and wiped out the medical records of thousands of Floridians.
But when electricity is out for 2 or 3 weeks, sometimes a month, as has happened to us even in the recent years, we can't hook up those systems. We have no way of getting those results unless they're connected to something like Florida Shots.
I really didn't have that much experience with immunization registry. I knew it was a national movement afoot, and it made some sense to me, but Katrina brought it home.
Julia St. Petrie is a Tallahassee pediatrician who used Florida Shots to link immunization records of families who evacuated their Gulf Coast homes because of Hurricane Katrina.
So when that child came over here and was trying to get into school because their house had been devastated and they couldn't go back for at least 6 months and they didn't want to miss school, we could call their state registry and get the immunizations. And that's when it really hit home with me how wonderful it is to have a central registration database.
While Florida Shots can help deal with natural disasters and medical emergencies, many families still face a financial challenge when it comes to getting vaccines.
Especially in primary care in this country, I see more uninsured children now or underinsured children than when I started.
It's an undue, unfair burden on a parent who does not have the money to pay for vaccines. Some of these cost hundreds, more than $100 a piece.
To help ease that burden on parents, Congress created the Vaccines for Children program in 1993. The Florida Vaccines for Children program began in 1994 and since 2005 has distributed over $100 million worth of vaccines annually to private physicians, hospitals, and other public and private healthcare providers throughout the state.
Close to 50%. It varies. It ranges around 50% of children are eligible for vaccines for children. So we're talking about a huge number of kids. You wouldn't think that.
Children up to age 18 are eligible for the Florida Vaccines for Children program, provided they meet any of the following criteria: are enrolled in Medicaid, have no health insurance or insurance that does not cover vaccinations, or are Native American or Alaskan Native.
Vaccines for Children has helped poor children because whether they have Medicaid or no insurance, no health coverage, no means of paying for vaccines, they can get their vaccines.
For patients, the Florida Vaccines for Children program eliminates cost as a barrier to vaccinations. It also allows patients to receive vaccinations from their established primary care physician, and it works to improve overall public health and safety. The Florida Vaccines for Children program provides a number of benefits to providers. It allows full vaccination of all children. It maintains continuity of care with patients regardless of financial status. It increases vaccination rates and decreases missed opportunities. It also does not impact private vaccine purchases. Together, the Florida Vaccines for Children program and Florida Shots enable providers to give the best care to their patients and remove financial status as a roadblock to good health. Enrollment in Florida Shots and the Vaccines for Children program is free for licensed providers and can be completed online at any time. Just head to www.flshots.com for Florida Shots and www.immunizeflorida.com/VFC for Vaccines for Children.